One introduction RAWSEP view: the United States government was on track in the Biden administration to reduce the prices for both clean energy heat pumps and clean energy electric cars. Trump tariffs are expected to upset those plans to prevent future air pollution and prevent climate change. The United States government should, instead of certifying wood stoves as safe when they are not safe, go forward with regulations that ban wood stove use and direct government money for use of forest refuse only. For home building and furniture building, for just a few examples of use of forest products for non-burning uses, it is well known from scientific and medical research that wood burning is a substantial source of PM 2.5 emissions, yet the wood burning industry uses the scientifically debunked theory named carbon neutrality of wood burning to argue that wood burning replacing coal burning in industry, and in a trickle-down argument that wood burning should continue for home heating should continue. Presumably because it is called renewable, wood may be renewable in the sense that a tree can be planted in the place of a cut-down burned tree, but it takes centuries or decades for the newly planted tree to attain the stature of the cut-down burned tree. During those centuries or decades, photosynthesis, which converts CO2 to oxygen and so sequesters some carbon, will not take place at the same rate as photosynthesis was performed previously, and wood burning emits both CO2 and PM 2.5, and PM 2.5 is not absorbed by trees, so PM 2.5 is not diminished by planting a tree in the place of a cut-down and burned tree. In fact, a living tree closes its pores against the presence of PM 2.5 from nearby wood burning, just as humans hold their breath in the presence of PM 2.5 from nearby wood burning. And when a tree closes its pores, the level of photosynthesis that absorbs CO2 pollution goes down. Wood burning emits 90% PM 2.5 particulate matter of 2.5 micrometer size, the perfect size to infiltrate the human lungs, setting off a cascade of human health problems and early deaths. Contrary to many beliefs, wood burning emits 2.8 times the PM 2.5 as the fossil fuel coal burning, and wood burning emits 450 times the PM 2.5 as the fossil fuel natural gas burning. Replacing coal burning with wood burning creates more air pollution in the form of CO2 and PM 2.5 than coal burning. This emission data comes from testing the cleanest burning wood stove in the United Kingdom, the Eco-Design Wood Stove, and International Convention does not count the emissions from wood burning. The emissions from wood burning are erased from all countries around the world when calculating if each country has met its climate goals. This non-counting or erasure of wood burning emissions data from climate goals does not mean wood burning emissions do not exist. RAWSEP view: purple air PM 2.5 monitors hanging from the eaves of the house of a near neighbor should be used to measure the level of PM 2.5 in the air hyperlocally in the yards of near neighbors of indoor residential wood burners. If PM 2.5 levels exceed World Health Organization standards of 5 micrograms per cubic meter annually, then that evidence of air pollution from wood burning should lead to the shutdown of that indoor residential wood burning appliance, one appliance at a time if necessary.
Hi, my name is Lily. Andrew gave you the intro to Residents Against Wood Smoke Emission Particulates and their concern for air pollution from indoor residential wood burning. Residents Against Wood Smoke Emission Particulates, or RAWSEP, would like every near neighbor of an indoor residential wood burner whose wood smoke enters their yards and sickens the near neighbors to have a purple air PM 2.5 monitor hanging from the eaves of their home to measure the level of PM 2.5 entering their yards. That measurement of air pollution should be used as evidence of unnecessary air pollution, and each indoor residential wood burner should be shut down based on that evidence, one indoor residential wood burner at a time if necessary. The presentation by Andrew ended at 2 minutes 5 seconds. The same presentation by Emma starts at 2 minutes 3 seconds before the end of this podcast. So I am Lily, your timekeeper, and you can start the next podcast at 2 minutes 5 seconds in if you would not like to see the presentation by Andrew a second time. This presentation by me, Lily, ends at 5 minutes in. What you will see in the main content of this RAWSEP podcast will be news about air pollution from indoor residential wood burning and how that air pollution is being combated by ordinary people just like you who are unfortunately near neighbors of indoor residential wood burners at this time. There will also be news about unnecessary and highly polluting use of wood as fuel in industrial wood burners and preventable air pollution from wood burning wildfires. There will also be news about air pollution from PM 2.5 from gas-powered cars. There will also be news about airborne diseases which are also preventable with vaccines such as COVID-19 and measles and whooping cough, to name just a few. In 2025, Residents Against Wood Smoke Emission Particulates is also concerned with combating the Trump destruction of government funding for programs which protect human health through the Department of Health and Human Services, and Trump destruction of programs which fund the science and medical research plan to protect human health from preventable illnesses. Protecting human health is a patriotic act, and our defense against enemies is weakened if we are not as healthy as we can be. Heat pump rebates are now offered by the federal government, distributed through the eligible United States, are available in 2025, and are the best, cleanest, and now cheapest alternative to indoor residential wood burning if that burning is actually done to purportedly save money. Wind and solar as sources of the electricity that powers heat pumps and electric cars is also cheaper than burning wood. The adverse health effects that are caused by indoor residential wood burning also come at a cost to near neighbors, both in shortening and ending their lives, and in actual hospital, clinic, and funeral costs. Instead of being compensated monetarily, near neighbors should instead be able to achieve immediate relief by stopping indoor residential wood burning in their hyper-localized neighborhoods, which relief readings from purple air PM 2.5 monitors used as evidence of air pollution will help them achieve. Welcome to news about hopeful scientific and medical achievements that will also help us achieve the goal of clean air to breathe.
Webisode 57DHXYS October 24, 2025 ACA Marketplace premium payments would more than double on average next year if enhanced premium tax credits PTCs expire. In Webisode 57DHXYS, ACA Marketplace premium payments would more than double on average in 2026 if enhanced premium tax credits PTCs expire. 1A The Republican Budget Bill in your district. 1B Example Madison, Wisconsin. Search by zip code on this website to get similar information. This is what the big ugly law will mean for your community. 2 Information from the KFF website. 3 From the Remodel Health website. Main content. 1A The Republican Budget Bill in your district. The Trump Big Ugly Law excerpts edited by RAWSEP for brevity and clarity in relationship to residents against would smoke emission particulates. A 501c3 nonprofit organization. Donald Trump and House Republicans promised to lower costs for American families. They lied. Republicans are betraying the middle class and raising costs on American families, all to pay for giveaways to Trump's billionaire donors. More than 15 million. Americans will lose their health care. Source Congressional Budget Office. Millions of people will lose food assistance. Source Congressional Budget Office. $3.4 trillion added to the deficit rises to over $4 trillion when interest costs are included. Source Congressional Budget Office. $500+ billion in cuts to Medicare. Source Congressional Budget Office. 760000. Manufacturing and energy jobs eliminated. Source Energy Innovation. Why? So billionaires and big corporations can get trillions in tax breaks. Over $5 trillion in tax giveaways predominantly to the wealthy and well-connected. Source Congressional Budget Office. $310,825 average annual tax cut for the richest. 0.1% estimate for 2027. Source House Budget Committee Democratic staff calculations based on JCT. Table JCX-37-25. 1B website https://democrats-budget house gov/legislation/big ugly law excerpts edited by RAWSEP for brevity and clarity in relationship to residents against would smoke emission particulates. A 501c3 nonprofit organization. Example Madison, Wisconsin. Search by zip code on this website to get similar information. This is what the big ugly law will mean for your community while Trump's billionaire donors get massive tax breaks. Families in WI02 will be left holding the bag, ripping away health care in your state. 276,175 people across Wisconsin will lose health insurance in your district. $1,040 average increase in premiums for people in WI02 covered under the Affordable Care Act in your state. 3 rural hospitals in Wisconsin would be at risk of shutting their doors by gutting Medicaid and attacking the Affordable Care Act. The big ugly law will push families towards poverty and force hospitals across America to close their doors, raising food costs in your state. At least 49,000 people across Wisconsin could lose some or all food assistance in order to fund their tax cuts for billionaires. Republicans voted for massive cuts to the Supplemental Nutrition Assistance Program, making millions go without food and forcing children to go to bed hungry, killing manufacturing jobs and raising energy costs in your state. 27,000 manufacturing and energy jobs in Wisconsin will be eliminated in your state. $470 average yearly increase in energy bills for Wisconsin families. Nonpartisan estimates show that by eliminating investments in clean energy manufacturing, the big ugly law will kill hundreds of thousands of jobs across America, increasing the cost of higher education in your state. 53924 students in Wisconsin will have their Pell Grants cut or eliminated entirely. Trump and Republicans in Congress are cutting funding for Pell Grants that help make a college education more affordable in order to line the pockets of billionaires and big corporations. And that is only the beginning. Republicans are targeting even more critical services to fund their tax cuts for billionaires and big corporations. The Trump administration is already undermining our nation's economy by threatening essential public servants with reckless layoffs. In WI02 alone, the federal government employs 5,859 people. Source 2 from the KFF website https://affordablehyphen-care-act-more-would-more-hyphen-premium-payments-would-more-hyphen-tax-credits-expire. Excerpts edited by RAWSEP for brevity and clarity in relationship to residents against would smoke emission particulates. A 501c3 nonprofit organization. ACA Marketplace premium payments would more than double on average next year if enhanced premium tax credits expire. Published September 30th, 2025. Affordable Care Act. ACA enhanced premium tax credits are set to expire at the end of this year. Enhanced premium tax credits were introduced in 2021 and later extended through the end of 2025 by the Inflation Reduction Act. The enhanced tax credits both increase the amount of financial assistance already eligible ACA Marketplace enrollees receive, as well as made middle-income enrollees with income above 400% of federal poverty guidelines newly eligible for premium tax credits. Since the introduction of the enhanced premium tax credits, enrollment in the marketplace has more than doubled, from about 11 to over 24 million people, the vast majority of whom receive an enhanced premium tax credit. If enhanced tax credits expire, many marketplace enrollees will continue to qualify for a smaller tax credit, while others will lose eligibility altogether and be hit by a double whammy of losing their entire tax credit and being on the hook for rising premiums. Since 2014, the ACA has capped how much subsidized enrollees pay for their health insurance premiums at a certain percent of their income on a sliding scale, with the federal government covering the remainder in the form of a tax credit. Enhanced tax credits work by further lowering the share of income ACA Marketplace enrollees pay for a plan. For example, with the enhanced tax credits in place, an individual making $28,000 will pay no more than around 1%, $325 of their annual income, towards a benchmark plan. If the enhanced tax credits expire, this same individual would pay nearly 6% of their income, $1,562 annually, towards a benchmark plan in 2026. In other words, if the enhanced tax credits expire, this individual would experience an increase of $1,238 in their annual premium. Free from the Remodel Health website, what healthcare changes are in the One Big Beautiful Bill Act OBBBA? Excerpts edited by RAWSEP for brevity and clarity in relationship to Residents Against Wood Smoke Emission Particulates, a 501c3 nonprofit organization, August 6, 2025. Health Insurance Education, https://remodelhealth.com/. What healthcare changes are OBBBA Congress passed HR1, also known as the One Big Beautiful Bill Act OBBBA, on July 3, 2025, with President Donald Trump signing the bill the next day. This bill included sweeping changes across various policy issues from energy to the federal budget. However, it also included healthcare-related provisions that may impact your employees or your clients. At Remodel Health, we have been monitoring how new federal legislation and regulations might impact the employee benefit space. In this article, we'll provide an overview of the healthcare changes included in the OBBBA. In this blog post, you'll learn what the One Big Beautiful Bill Act is, what major healthcare changes HR1 includes, the potential impact of OBBBA provisions, and provisions not included in the bill. Are you looking for a cost-effective alternative to traditional group health insurance? Learn how the ICHRA might be the solution for you and your clients. Learn more about ICHRA. What is HR1? The One Big Beautiful Bill Act? HR1, also known as the One Big Beautiful Bill Act, is a budget reconciliation measure that Congress introduced in the House of Representatives on May 20th, 2025. After passing both chambers of Congress, President Trump signed the bill into law on July 4th, 2025. The bill reflects a broad legislative effort to reshape certain aspects of the federal government, including taxation, federal spending, and benefits. Healthcare changes in HR1. The OBBBA, while the bill addresses a wide range of issues, its healthcare provisions are especially relevant for employers, employees, and benefits advisors. While the bill originally included language that would have directly impacted Remodel Health by codifying and renaming the Individual Coverage Health Reimbursement Arrangement ICHRA as the choice arrangement, the Senate removed the provision. You can learn more about what the bill would have done for ICHRA in our article on the topic. Although ICHRA isn't becoming choice as a result of the OBBBA, many healthcare-related provisions did become law. We'll highlight some of these changes in the sections below. ACA, individual market changes in OBBBA. The One Big Beautiful Bill Act introduced several changes to the individual health insurance market, including premium tax credits. The table below summarizes some of the provisions impacting the individual market. Summary of changes. OBBBA Section 1, Source, pre-enrollment verifications for advanced premium tax credits and cost-sharing reductions. A month will not count as a coverage month for APTC eligibility unless the exchange verifies the individual's eligibility to enroll in a plan and receive APTC payments. Exchanges must base verification on applicant-provided or verified information, such as household income, family size, legal immigration status, current health coverage, or eligibility, residence, and any other information. HHS can waive these requirements for special enrollment periods. SEPs caused by family size changes. Pre-enrollment verification begins for plan years starting after December 31st, 2027. Section 71303, impact of community engagement requirements for Medicaid on APTC/CSR eligibility. Individuals aged 19 to 64 and enrolled through Medicaid expansion or other Section 1115 programs are subject to new community engagement requirements, explained later in this article. For individuals who fail to meet these new rules and fall out of coverage, those months do not count as qualifying months of minimum essential coverage. MEC. This will impact premium tax credit and CSR eligibility. Section 71119, elimination of PTC for those using a low-income special enrollment period SEP starting January 1st, 2026. Individuals selecting coverage as a result of an SEP based on income will not be eligible for a premium tax credit. Note: a separate federal regulation 2 by HHS issued on June 25, 2025 eliminates all income-related SEPs through December 31st, 2026. Section 71304, individuals must file taxes and reconcile APTC for the previous year. This section eliminates the existing limit on the amount of excess advanced premium tax credits that individuals must repay based on income. All individuals must repay the full excess amount if they received more APTC than they were entitled to for tax years after December 31st, 2025. Section 71305, changes to tax credit eligibility for immigrants. Premium tax credits are no longer available to all lawfully present immigrants. The federal government now limits PTC to eligible aliens. OBBBA defines eligible aliens as lawful permanent residents, green card holders, Cuban and Haitian entrants under the Refugee Education Assistance Act of 1980, and citizens of freely associated states residing in the U.S. under a compact of free association. This section also limits those subject to the ACA's individual mandate to citizens and eligible aliens. This applies to tax years beginning after December 31st, 2026. Section 71301, individuals subject to the Medicaid 5-year bar cannot collect premium tax credits. The bill prohibits individuals from collecting PTC during periods of Medicaid ineligibility due to their immigration status. Section 71302, OBBBA isn't the only recent change in federal law that impacts the individual market. A new final rule issued by the Trump administration will shorten the annual open enrollment period in all states starting in 2026. Open enrollment will run from November 1st through December 15th for 2027 coverage on the federal marketplace. The final rule also shortens open enrollment on state-based marketplaces from November 1st to December 31st. This rule also reduces APTC by $5 for those who auto-enroll again in fully subsidized plans without verifying their eligibility. Again, 3 HSA changes in OBBBA. The One Big Beautiful Bill Act includes several updates designed to expand the use of health savings accounts. HSA summary of changes. OBBBA Section 1, Source on exchange. Bronze and catastrophic plans are now HSA eligible. The federal government now recognizes bronze and catastrophic individual health plans as high-deductible health plans, HDHPs. This allows those with bronze or catastrophic plans to contribute to a health savings account, HSA. This change takes effect on January 1st, 2026. Section 71307, direct primary care service arrangements do not disqualify someone from contributing to and has beginning January 1st, 2026 a direct primary care service arrangement will not be treated as a disqualifying health plan for HSA eligibility. To qualify, a DPC must only provide primary care services. These plans have a fixed periodic fee, and monthly fees cannot exceed $150 for individuals or $300 for families. If the DPC exceeds this amount, it doesn't qualify as a DPC. The government indexes this amount for inflation. Section 71307 direct primary care fees are HSA eligible. DPC fees are now an HSA eligible medical expense starting on January 1st, 2026. Section 71307. These HSA changes could benefit those who enroll in an on-exchange bronze or catastrophic plan. With their ICHRA allowance, these plans have lower premiums, but higher deductibles and out-of-pocket expenses than silver or gold plans. Employees with these plans can contribute to an HSA for their out-of-pocket costs while using their ICHRA allowances for their individual health insurance premiums. However, the changes will not impact the vast majority of ICHRA participants who have off-exchange plans. Medicaid changes in OBBBA. Medicaid is a federal and state program that provides health insurance coverage to low-income individuals and families. It also supports pregnant women and those with disabilities. HR1 introduces significant reforms to Medicaid. Summary of changes. OBBBA Section 1 Source changes to Medicaid rules. These sections block the implementation of the CMS final rules issued on September 21st, 2023 and April 2nd, 2024. These final rules would have made it easier for Medicare enrollees to enroll in Medicare savings programs (MSPs) and streamline the process for applying for and renewing Medicaid and CHIP. This moratorium is effective now through September 30th, 2034. Sections 71101 and 71102 state-directed Medicaid payments. This section limits how much states can pay providers through Medicaid. Managed care state-directed payments. The government will cap payments at 100% of Medicare rates for Medicaid expansion states and 100% of Medicare rates for non-expansion states. If there is no Medicare rate for a service, the state should use the Medicaid state plan rate. Existing payment arrangements must begin to phase down their payments starting in 2028. Section 71116. Medicaid expansion redetermination, starting with eligibility reviews scheduled on or after the first quarter of 2027. States must perform mandatory 6-month redeterminations for some Medicaid enrollees. Those subject to these redeterminations include those covered under Medicaid expansion and those with a Medicaid waiver that covers the same expansion population and provides minimum essential coverage. MEC Section 71107 Medicaid community engagement requirements. This section requires most Medicaid expansion enrollees to meet new work or community engagement requirements to remain eligible. Anyone aged 19 through 64 with Medicaid expansion or an equivalent waiver must engage in at least 80 hours per month of employment, community service, work program participation, half-time enrollment in education, a mix of the above, or earn income equivalent to 80 hours at minimum wage. There are exemptions for pregnant and postpartum individuals, those with disabilities or serious medical conditions, and caregivers of young children or dependents with disabilities, among others. These engagement requirements must begin by Q1 of 2027, and states may start earlier if they choose. Section 71119 new cost sharing requirements for Medicaid starting October 1st, 2028. States must impose cost sharing on certain higher income Medicaid expansion enrollees. This includes copays or fees. It also prohibits states from charging premiums or enrollment fees on these individuals beginning in 2029. Section 71120 changes to Medicaid retroactive eligibility. This section limits the retroactive coverage period for Medicaid and CHIP, reducing the number of months states must provide coverage before the application date. For those with Medicaid expansion, retroactive coverage is reduced from 3 months to 1 month before the application month. All other Medicaid enrollees and CHIP enrollees will have retroactive coverage limited to 2 months, down from 3 months. This law takes effect on January 1st, 2027. Section 71112 reducing duplicate enrollment under the Medicaid and CHIP programs. This section aims to prevent individuals from being enrolled in Medicaid or CHIP in more than one state at the same time. By October 1st, 2029, HHS must create a federal system that receives enrollee data and flags those enrolled in multiple states. Section 71103 adjustments to coverage of home or community-based services HCBS under Medicaid starting July 1st, 2028. States may apply for a new type of standalone Medicaid waiver to cover home or community-based services for those who do not meet the traditional institutional level of care requirements. Section 71121 Medicaid eligibility for immigrants effective October 1st, 2026. Federal Medicaid funding will only be available for services provided to individuals who meet specific immigration and residency criteria. Only U.S. citizens or nationals, lawful permanent residents, Cuban or Haitian entrants, or citizens of a compact of free association nation lawfully residing in the U.S. will be eligible for Medicaid. These changes mostly affect lawfully present immigrants who no longer meet the new eligibility requirements. Federal law already prohibited undocumented immigrants from enrolling in federally funded Medicaid programs, except in emergency. Section 71109. So how might these Medicaid changes impact the individual market? Some individuals may switch from Medicaid to a subsidized marketplace plan, but with the potential loss of enhanced premium tax credits at the end of 2025, low-income individuals who are generally healthy might forego coverage. This could increase the share of unhealthy individuals on ACA plans, increasing premiums. Changes to Medicare in OBBBA, much like the changes to PTC and Medicaid eligibility. HR1 included Medicare eligibility changes. Section 71201 creates a new rule. Section 1899C of the Social Security Act. It limits Medicare benefits to U.S. citizens or nationals, lawful permanent residents, Cuban or Haitian entrants, and citizens of compact of free association nations lawfully residing in the U.S. This takes effect 18 months after enactment or around January 2027. These changes affect lawfully present immigrants who no longer meet the new eligibility requirements. 1-year ban on federal funds for certain providers. The bill also included a 1-year temporary ban on using federal funds to pay certain entities. This applies to Medicaid plans and those with a state Medicaid waiver for 1 year from enactment. Individuals cannot use Medicaid to pay for services from a prohibited entry OBBBA, that is any organization that meets all of the following criteria. It is a 501c3 nonprofit organization. It is an essential community provider. It is primarily engaged in family planning or reproductive health services. It provides abortions. Except in cases of rape, incest, or life endangerment, it received more than $800,000 in total Medicaid reimbursements in 2023. As of the writing of this article, a federal judge has blocked this provision, pending legal challenges. Potential impact of provisions OBBBA included and didn't include on the individual market. So what is the impact of the OBBBA? On June 27, 2025, the Federal Congressional Budget Office CBO estimated that the provisions in H.R. 1 would result in 11.8 million individuals losing health coverage during the next 10 years. For this includes Medicaid, Medicare, CHIP, and individual health insurance driven by new work requirements, eligibility restrictions, and subsidy reforms. While OBBBA introduces new consumer tools like expanded HSA eligibility, it also omits an extension of the enhanced premium tax credits that the American Rescue Plan Act of 2021 and the Inflation Reduction Act of 2022 created. Originally, these tax credits were only available to those with annual household incomes between 100% and 400% of the federal poverty level FPL. You also had to be ineligible for affordable coverage. The American Rescue Plan Act expanded access to PTC by allowing anyone who would have to pay more than 8.5% of their household income for a benchmark silver plan to qualify. In addition to needing to meet the affordability requirements, these enhanced credits, which made plans more affordable for millions, expire at the end of 2025. If Congress doesn't extend these enhanced tax credits, the CBO projects 4.2 million more people will be uninsured by 2030. Many healthy individuals could leave the individual market and forego coverage to save money. This would lead to a sicker risk pool in the individual market, driving up premium costs. Tighter eligibility for premium tax credits and cost-sharing reductions for certain immigrants could also reduce the number of enrollees on the individual market. In an evolving and more complex health insurance environment, employers and brokers will need to carefully evaluate their options and analyze the impact on their employees and clients. Remodel Health is here to equip employers and benefits consultants with the guidance needed to evaluate the ICHRA as an alternative benefit strategy. Conclusion: the One Big Beautiful Bill Act includes many healthcare and employee benefit-related provisions, with millions expected to come off Medicaid. And with the expiration of enhanced tax credits on the horizon, employers and brokers must take proactive steps to stay ahead. You should review your current benefit strategy to ensure it aligns with the upcoming changes. Sources: H.R. 1 One Big Beautiful Bill Act, Federal Register, Patient Protection and Affordable Care Act, Marketplace Integrity and Affordability. CMS finalizes major rule to lower individual health insurance premiums for Americans. Congressional Budget Office estimated budgetary effects of an amendment in the nature of a substitute to H.R. 1 KFF. How will the One Big Beautiful Bill affect the ACA, Medicaid, and the uninsured rate?
Red Green Fox here. The quick red green fox jumped over the barriers to clean air. Red Green Fox here. Ready to sing to you the names of the 2025 major wood-burning biomass industry subsidy opponents. 1. Biofuel Watch. 2. Bulkley Valley Stewardship Coalition of British Columbia, Canada. 3. Comite Schoen Luft, which means Beautiful Air Committee in German. 4. Dogwood Alliance. 5. Equity Group Foundation, nicknamed EGF. 6. Environmental Paper Network, nicknamed EPN. 7. Natural Resources Defense Council, nicknamed NRDC. 8. Prakaunia Narzexwisistik Istit, which means Workshop for All Beings in Polish. 9. Rachel Carson Council. 10 Solutions for Our Climate, nicknamed SFOC.
Cat's corner strategy with Tiger and Leone. Saying the quiet part out loud. Roar. Hi, I am Tiger. Our human asked us to get up from our naps and start Cat's Corner strategy with Tiger and Leone. She gave us a list of internet allies, which we will post for her here.
Hi, I am Leone. It is better for your mental fitness to go to these websites than to go to bro sites for advice. Substack letters from an American Heather Cox Richardson. Substack your local epidemiologist. The Midas Touch. The Guardian. The New York Times.
One introduction. RAWSEP view: the United States government was on track in the Biden administration to reduce the prices for both clean energy heat pumps and clean energy electric cars. Trump tariffs are expected to upset those plans to prevent future air pollution and prevent climate change. The United States government should, instead of certifying wood stoves as safe when they are not safe, go forward with regulations that ban wood stove use and direct government money for use of forest refuse only for home building and furniture building. For just a few examples of use of forest products for non-burning uses, it is well known from scientific and medical research that wood burning is a substantial source of PM 2.5 emissions, yet the wood burning industry uses the scientifically debunked theory named carbon neutrality of wood burning to argue that wood burning replacing coal burning in industry, and in a trickle-down argument that wood burning should continue for home heating should continue. Presumably because it is called renewable, wood may be renewable in the sense that a tree can be planted in the place of a cut-down burned tree. But it takes centuries or decades for the newly planted tree to attain the stature of the cut-down burned tree. During those centuries or decades, photosynthesis, which converts CO2 to oxygen, and so sequesters some carbon, will not take place at the same rate as photosynthesis was performed previously, and wood burning emits both CO2 and PM 2.5, and PM 2.5 is Not absorbed by trees, so PM 2.5 is not diminished by planting a tree in the place of a cut down and burn tree. In fact, a living tree closes its pores against the presence of PM 2.5 from nearby wood burning, just as humans hold their breath in the presence of PM 2.5 from nearby wood burning. And when a tree closes its pores, the level of photosynthesis that absorbs CO2 pollution goes down. Wood burning emits 90% PM 2.5 particulate matter of 2.5 micrometer size, the perfect size to infiltrate the human lung, setting off a cascade of human health problems and early deaths. Contrary to many beliefs, wood burning emits 2.8 times the PM 2.5 as the fossil fuel coal burning, and wood burning emits 450 times the PM 2.5 as the fossil fuel natural gas burning. Replacing coal burning with wood burning creates more air pollution in the form of CO2 and PM 2.5 than coal burning. This emission data comes from testing the cleanest burning wood stove in the United Kingdom, the Eco-Design Wood Stove International Convention does not count the emissions from wood burning. The emissions from wood burning are erased from all countries around the world when calculating if each country has met its climate goals. This non-counting or erasure of wood burning emissions data from climate goals does not mean wood burning emissions do not exist. RAWSEP View Purple Air PM 2.5 monitors hanging from the eaves of the house of a near neighbor should be used to measure the level of PM 2.5 in the air hyperlocally in the yards of near neighbors of indoor residential wood burners. If PM 2.5 levels exceed World Health Organization standards of 5 micrograms per cubic meter annually, then that evidence of air pollution from wood burning should lead to the shutdown of that indoor residential wood burning appliance, one appliance at a time if necessary.